see if that helps. Okay. All right. So Chloe, if you could advance the slides, please. All right. So just a reminder, we don't need to go through all this, CRIS committee members. And then Michael, can you? Awesome. Thank you. All right. So CRIS committee members, on Zoom, if you could keep your mics on mute, but your video cameras on to the extent that it's available to you, that's going to help us facilitate today. As I said before, if you would like to send a chat, please send it to Michael Anderson Mathy, and he will be tracking and helping you bring those chats into the space here. Why don't we go ahead and just advance the slide to the next page? All right, members of the public on Zoom, if you could keep your mics on mute today and your video cameras off, that's going to be really important for us to be able to facilitate today, especially because it's a little bit more complicated with this hybrid piece. All right, let's advance the slide. All right, so again, today our meeting objectives are, first of all and foremost, to strengthen our relationships with our fellow CRIS members. This is a long process. It's a lot of work. And the more that you connect with each other, the more we can work together, particularly on the tricky things. So I'm really grateful that we've had this time together. Yeah.
You can speak softer, that means better on the Zoom. Also slower and softer.
Okay, thank you.
That's hard.
No, it's over.
Thank you for being so flexible.
I appreciate people providing feedback.
Well, I'm getting it from the folks on the Zoom.
Okay.
And
Okay.
also, if CRIS members can turn their cameras on, it's a request.
Yes.
Folks, yeah.
Okay. So CRIS members on Zoom, how's this working? CRIS members on Zoom, if you could turn your cameras on, please, that would really help us facilitate. Mark, is this sound working better? I can see you. Yes. Okay, great. You just keep letting us know if it's not working and I will modulate. Okay. But as I was saying earlier, our second objective today is to understand CRIS members' perspectives on and criteria for determining priorities for recommendations. So our steering committee is meeting next week to start to work out what's going to go in the 2024 progress report. And they're going to be really counting on your insights, Jody. You're going to be hearing from a couple of them specifically about that. And then we're going to actually go about prioritizing recommendations for addressing system gaps to propose to this CRIS steering committee. We'll confirm action items and next steps. And then if anyone signs up to make public comment, we'll do that at the end. All right, let's advance the slide, please. So here's our approach. I'm going to have to do a little adjusting because our tech problems set us back a little bit, but we'll manage. We're going to hear our personal story, and then we're going to do that prioritization criteria conversation. We'll take a break and then come back and actually do the prioritization of the 2024 recommendations. Then we'll go to action items, the next steps, and finish out with our public comment period. One other piece of housekeeping for people in the room. The hotel gave me discount parking tickets. This allows, so when you go through the parking lot, you'll put the parking ticket you pulled, and then you'll slide this in and it gives you a discount. So please, if you need one, come see me at the end and I'll make sure that you get one. If you have to leave a little early, we'll just keep them over here and you can grab one on your way out. And this is for CRIS members and our guests who are in the room today. Okay, let's advance the slide, please. Okay, I'm going to turn it over to Betsy, who's going to take the mic for a moment and just remind everybody about where we are in our process here.
Yes, and we are here today in our, well, we're not here today because this is all the way through August. So this really reflects the work that we've done to date, looking at our pillars, someone to come, someone to call, someone to come, a place to go. So we've been making our way through all of the pillars, thinking about our recommendations. And we started to do some synthesis work last month. Next slide, please. Just speak louder. Okay. Okay, here, get closer to the mic. Today we are at the process of drafting some policy recommendations that will form the foundation for our January 24 committee report. So all of this work that we're doing is being rolled up. It's been continually rolled up. More than anything, we want you all to see how your work is being reflected this year. Last year, we heard a lot about how it didn't feel like we got to deliberate enough as a CRIS. And so we really want to show you the breadcrumbs. We've been using that phrase a little bit. So that everybody can see how recommendations are informing the report. And also, it's really important that we've been getting some feedback from our lived experience subcommittee, our rural and agricultural communities subcommittee, and we also have tribal recommendations that we're bringing forward. So in October, we'll begin the process of drafting. We have a steering committee meeting actually next week after this, where we'll bring forward the work that we've done today, begin drafting the report, and then come back in November for a review of this committee. So again, we're having lots of bites of the apple, figuratively, to be able to inform that report.
Betsy, I think you had an announcement that you were going to share with the community as well. Yes.
Well, I wanted to say goodbye to Megan.
Mm-hmm.
So Megan Celedonia is leaving us. She's moving on to be the Director of Strategy and Innovation of the Department of Corrections. And I asked to do this this announcement because Megan has been really, really critical. I'm sure you all know and feel her presence here in the room, but also she's been a critical partner to those of us who are doing the work behind the scenes. Megan is one who doesn't pull any punches, and I've really, really appreciated and respected her for that. At the same time, she's a huge community builder. So Megan, we'll miss you. We thank you for the work that you've done. Big shoes to fill. So I don't envy the Gov's office on that. So thanks. Let's say thank you to Megan.
Marcus, I'm hearing that this mic works better than the one I was using. So
Yep.
Yes, I am getting a lot of positive feedback. Okay, awesome.
We're doing it, Jamie.
Yeah.
So much better.
Yes, this is okay. Also, that's great news. That's excellent news. Okay. Also, we have another announcement and update. Matt, can I invite you up here? And I think that the mics on the table are the best way to go. So maybe the one next to Jessica. So Matt Gower with HCA has some news to share as well.
Good afternoon. My name is Matthew Gower. I'm the crisis system team lead here at the Healthcare Authority. And we've been working on implementing the stipends that were set up by Senator Dingra's initiative through the Office of Equity to get payment to you guys for if you're lived experience or within certain financial means. I believe it's 400% of the federal poverty line. We'll be sending out an announcement here probably in the next day or two with more information in the form to fill out. It's called an A20. It looks very intimidating. It's actually not, but if you do need any assistance with it, please let us know and we will help you with it. And we're looking to try to get these payments for CRIS Committee, Subcommittee, Lived Experience Subcommittee, including Kristen, all the way back to January of 2023 this year. So I'm excited to actually be able to announce that here because I know that's something that we've been working on for a while.
All right, so just a reminder, Matt, you'll be sending, or HCA will be sending out an email to provide all the details to folks as a follow-up?
Yes,
okay.
So you guys don't have to remember it here.
Okay. Excellent. Thank you, Matt. And thank you everybody who worked so hard to get us to this place, including our lived experience planning committee group.
I don't know how to get it.
It'll be easy to find, right? Yeah.
So we are gonna leave you alone.
There was a lot of messages of thank you to Megan for her work in the chat to Brittany.
Okay. Megan, there's a bunch of messages in the chat to Brittany thanking you for your work. So wanted to relay that to you. All right. Let's get into it then. So I'm going to turn it over to Bipasha to introduce our personal story today.
Okay, let me know if people can hear me and what But Michael Jason Robertson, born in Tri-Cities and grew up in Renton from a family of 6 siblings, 4 of whom were adopted, you told me? All right. Went to Liberty High School when his dad was a CS teacher from 1979. I'm thinking like, that's the beginnings of technology, the tech world, not technology. Michael specifically told me to say that he is 53 years old in a culture where ageism, I think, is one of the deepest isms. It matters to speak out how many times you've taken a spin around the sun. Also, I just learned he likes cookies and he gave me his apple. Just saying, folks. The details make us human. Michael, the man who also tells me, why are you sending me texts late at night? Sometimes he gets a bit crabby and I snap back at him. Well, Michael, that's when I'm up and alert. But what I hear Michael say is that I want to hear what you're saying to me and I want to respond. And I can't do that at 10 p.m. Bipasha, because I'm at work at 5:15 in the morning and I take public transportation to work to meet the needs of some of the people who have some of our deepest needs. So I hear you, Michael. I'll do better. Michael has worked as a CPC certified peer counselor, that is, for people who don't know, for 3 years at Peer Kent, an agency, I think, that's thick in the middle of dealing with the fentanyl epidemic right now in our state. And Michael sees that every day of his work. I see how hard he works and how consuming his work is, which makes me come back to the idea of compensating our folks in the system well and taking care of them, because, you know, you can pay me a lot, but I only have 24 hours a day. And if you burn me out, no amount of money is going to help me. He brings a very unique perspective, both personal and professional. He's honest about his journey on substance use and his felonies. I learned today that his family of origin had substance use journeys that he didn't even know about when he was growing up. Just aside, he's a DJ also, if people didn't know, since 2017, and he's a professional DJ since 2022, last year. He does EDM music and creates an environment where people get a moment to forget about life and how difficult it can be. I really value Michael's input because he opens my eyes to things that my privilege blinds me to, and I really appreciate that. It can be difficult. He will challenge us. And I appreciate that because I think we grow when we step out of our comfort zones. And so thank you, Michael, for that. And with that, I'm going to be quiet so you can hear him. Here is Michael Robertson, my colleague and my friend.
Thank you, Pasha. I hope that's not too loud. I'm Michael Robertson, pronouns he, him. As she mentioned, I am a certified peer counselor. I'm with Peer Kent. I've been on the committee since its inception, and so we were all still jockeying emails back and forth way back when. And one of the things I think that was important, that as soon as I saw they were looking for persons with lived experiences, particularly in the realm of crisis response, because I come from, not directly from communities, but I know people in communities, because I grew up in a sort of a privileged kind of lane, being adopted, growing up in the suburbs, raised by a white family. And one thing that I know that it is not uncommon to see is inside of crisis, as I begin to venture out on my own, is to see communities with persons that look like me that did not have crisis response, emergency response at their best interest. And so I knew that this was a lane that I had to step into and maybe offer some insight. I also am a person in long-term recovery from substance use disorder. And so as she mentioned, I'm 53 and we've come a long way as far as a society, just recently, as far as how we deal with stigma and how we deal with lived experience when it comes to substance use disorder. I had never been in trouble as a juvenile, and my first time in trouble as an adult was during the height of the war on drugs. And so for $20 worth of drugs, I went to prison for 21 to 26 months with no prior felony record, no juvenile record, no nothing. And so I've been inside of systems that are in need of change, directly inside of systems that are in need of change. And so I really thought that it was important that I start to show up and not to like, and I have to be really careful in how I show up as a man of color, particularly with that lived experience, because without allyship, and for those that may have a more conservative view of some of the issues that we're addressing, I knew that I may come across as disgruntled, vindictive, in my how I address the need for change, right? And so I knew that I needed to connect with some of the folks here. And my experience so far with the CRIS Committee is we're all learning at the same time. We have a mission statement, I think. I was on one of the committees for that. We designed a mission. We didn't even fault or we were being ignorant. We didn't know how to describe this thing. We didn't really know how to describe it. And so I've pitched in on that as well. This is my second time sharing my experiences. So if there are any, there's probably a lot of people. I'm looking at some of the names. There's some people that have already heard my story. And so I'm just kind of giving a synopsis of how it's begun to morph, right? As she mentioned, I'm a CPC with the largest peer-run, peer-driven organization in the state of Washington, Pure Washington. And so some of us that are in this room, we see each other in different types of meetings and different advocacy, and we run into each other pretty frequently. My boss is often on these kind of calls, as well as the University of Washington and their behavioral health arm and their ADAI. And so this community is most effective if we stay put, because one thing I've learned in the last 3 years, there's not a lot of us. There isn't that many of us. We run into each other in emails and on Zooms all the time. And so I plan on staying put. I'd just like to thank everybody here for their service. I want to thank the people that are tuning in. It's important that there's 3 things that we need to do. We need to understand the intersectionality of behavioral health and don't let people begin to separate. We need to not allow people to separate people to separate persons from the malady, right? We are all true people that we're addressing, right? The second thing is that we need to increase stigma under the guise of rewriting their own description. Instead of being abolitionists, they're being allies. Anyone can be an ally. And somebody that rolls up to an accident and says, "Oh my goodness, look, somebody's hurt." An abolitionist actually jumps out of the car and begins to save, right? And apply that care and that trauma and first aid. And the last thing is how to be selfless, how to listen constructively, and how to really support those that don't have the voice to do so. Again, I'm Michael. I am a person with lived experience, and thank you for letting me be of service.
So Michael to Michael. I was asked to acknowledge your story. So thank you for sharing who you are. I'm one of those people that has experienced you at other meetings, so I feel like I've learned more about you in sharing your story today. It's always so wonderful to have a personal story to ground us at the beginning of a CRIS Committee meeting. And we've heard so many others tell their stories bravely, courageously, and compassionately and empathetically. Kudos to you for doing it in person for the first time at this committee meeting. So thank you for that. Thank you for sharing your perspective. And in my mind, it's always important to think about how we approach the work we do in a professional yet personal, compassionate way. And all of our perspectives are key and keen. And we all have our own perspective. So hearing from each other and truly listening to hear your perspective is so important to help us to be on a path that's going to be helpful to the larger system. Being a man of color, being a person on the SUD journey, Sharing that story with us adds to our perspective to be with you. I also love that you're a DJ. Music makes us feel things, and that's important. So you're also a man of music, and you love cookies. Can't go wrong with that. So for all of that, Michael, thank you for sharing who you are, your story with us, and being with us today.
Statewide fundraiser as a keynote speaker, one of the keynotes. So you're more than welcome to join me there as well. I have more story to tell. So
Michael, what's your Instagram? Fun following.
it's at Avignon, like the region in France, .dj. So
Follow Michael.
Okay, I'm gonna repeat all that because I'm not sure our Zoom folks, and this is very important information. So Michael is going to be appearing as a keynote speaker at the NAMI conference,
at the yearly fundraiser.
the yearly fundraiser. So look out for him. And maybe we can put it in the chat. If you'd like to follow Michael's Instagram, it's Avignon, like in France.
Exactly.
DJ.
.dj.
So Brittany, if you can put that in the chat.
Thank
Also, we did get a note that the Marcus, that the mic that Michael was Michael was speaking. We can't even say Michael R.
That one worked, but this one is coming out.
Okay, we might still be having some iffy mic stuff over here. So folks on Zoom, please keep letting us know and we'll keep troubleshooting over here. So this Michael over here, do you know which mic it was that they were concerned about?
I thought it was that link, but I know this one was kind of in and out.
Okay, all right. We'll also try to. I think Betsy's is the best one, so I might just start bringing that around. And okay, we'll do our best here. All right, Michael Robertson, thank you so much for telling your story today and for being. Oh,
just with those mics, it would be good if you speak directly into the mic. Some people, everyone's kind of different, but I mean, the closer the better, not too close, but.
Okay, so I need to be done like this. Okay, so everybody else, we'll do a little trial and error and it'll work. And again, I just appreciate everyone's grace today. It is what it is. But yes, Michael Robertson, thank you so much for sharing your story today and for and like was said, for doing it in person. And I also appreciate the messages you offered at the end of what you were saying about how we show up in the world. And I'm going to remember those things. Let's talk about back to, I was starting to give a little spoiler alert to the CRIS committee members in the room about what we were going to do next, which is prioritization criteria. And to help set the context for why we want to talk about this, I'm going to ask one of our steering committee members, Michelle Roberts, to share a few messages about what the purpose of our exercise is here.
Okay, we'll see if my mic distance works okay. Good afternoon, everybody. For those that I don't know, my name is Michelle Roberts, and I serve as the Assistant Secretary for our Prevention and Community Health Division at the Washington State Department of Health. And it's an honor to be here with you all today. I use she, her pronouns, and I also represent the department on this committee and represent the department on the steering committee as well. And on behalf of the steering committee, we wanted to say a little bit to set up kind of the discussion and what we need to do together today. The steering committee has 6 seats on it, I believe. 2 of our legislative members, the 2 primary state agencies, the Department of Health and Healthcare Authority, the governor's office, Bapasha as lived experience, and actually, so now I'm up to more than however many, whatever number I said, Mark Snowden from the Behavioral Health Institute. And our job is to take the discussion and what's happened from this committee to try to synthesize it and hopefully make sure we're putting the final recommendations in place. Our recommendations from the CRIS and from the steering committee go to the governor's office and to the legislature. So this is really key to helping us drive what's next and help the governor and the legislature decide where the next investments need to be made. So our work is really critical together, and we need everybody here to help share your perspective and your insights to help us make sure we're moving in the right direction. Today's exercise, we're going to start off thinking about, before we get into what recommendations, we want to start today about what criteria we may use to help guide those decisions. So I think this exercise is really thinking about the criteria and what things we may need to use to guide our decisions. So I think that's what we're going to want everybody to be focused on and do a little brainstorming about what criteria could be. Did I forget anything? Okay.
And yeah, that's perfect. Thank you. So as Michelle said, we want each of you to think about, each CRIS committee member to think about the criteria you would recommend using for prioritizing recommendations this year. And just a reminder, I said this to the folks in the room, but I want to make sure we reiterate it for our CRIS committee members on the screen. You have done a lot of work this year. We started, I think, in February, uncovering systems gaps in the someone. Later we worked on someone to come, and then more recently we worked on a place to go. You identified systems gaps, and you also articulated some recommendations or some at least proposed strategies for how to address those gaps. In addition, as was mentioned earlier, several of the subcommittees have been working on that as well. So the Tribal 988 subcommittee, the Lived Experience subcommittee, and the Agricultural subcommittee. These documents, and I have printed copies, not enough for everybody. We were trying to be a little conservative with paper, but we did bring 5 of each of those essential elements of the crisis system. We brought 5 of each so that you can reference them throughout the day. And for those folks in the room, I have them in different stations around the room. So you're welcome to refresh your memory on that, but you also have an emailed copy. We have synthesized all of that input into these documents, and I know they're bare, but as Betsy mentioned earlier, we heard feedback last year that was really important to have more deliberation and then track where you were going. And so that's the purpose of these documents. So now it's time to think about, okay, all this work, what are we going to put in that 2024 report, and how do we decide what goes in there? So I want each CRIS committee member to spend the next few minutes thinking about how you would prioritize things. I'm not going to ask you to agree on prioritization criteria. What I'm going to ask you to do, what Michelle's going to ask you to do, and the steering committee is going to ask you to do, is share what you think. And they will use that information to start making some of the decisions that they have to make next week. So people in the room, you have a notepad in front of you. You can use that to do what I call brain writing, which is just to think quietly to yourself and write down some ideas. And then our CRIS committee members, I see Dr. Snowden, I see Anna, I see Puck, welcome. I think I see Fennick up there, and Robert. I think I got everybody who's here if you could do the same exercise at home, just start really thinking about what your prioritization criteria will be. And then in a few minutes, we'll come back together and share out. And I offered a few prompts to get the CRIS committee in the room started here, and I'll share those with our folks on the screen too. So just a couple that we came up with, and this is just to seed your thinking. You can completely ignore them, you can modify them, or you can come up with entirely your own criteria. But some of the criteria that we might think about is urgency of the system gap that needs to be addressed. This recommendation addresses a critical roadblock that if we don't clear it, we're not going to get anywhere. Maybe it's a recommendation that is supported by people with lived experience. And of course, as we've all agreed, this process needs to center lived experience. Another criteria might be, it's an easy win. It's feasible to implement. And sometimes those easy wins can beget more wins. So those are just a few ideas to seed your thinking. It's 1:51 right now. Let's take the next 5 minutes to just write your ideas, and then we'll come back together and ask everyone to share out. Before I do, any questions about what I'm asking you to do? Okay, go ahead. 5 minutes. One more minute and we'll come back together. Betsy, while people are wrapping up their thinking, do you want to just share the clarification that you shared with me?
Yes, I do.
Okay.
So when we look, oh, I'm sorry, here I am. Forget that we've got two things going on. So when we look at the poster boards and we review input from the various subcommittees, you recall that I mentioned the tribal subcommittee, and we are engaging a formal process with the tribes to make recommendations. So the information that we have here is not complete or final. It's really for our awareness, just so that we know what's been going on in that during that tribal process with the Tribal Centric Behavioral Health Advisory Board that is our Tribal 988 subcommittee. So just a flag.
Michael just reminded me that we asked Fennec Oak, our newest CRIS committee member, to introduce himself earlier when we were together for our social time, but we should probably do that introduction again to the larger group. So before we start sharing out, or maybe the Fennec's on. Okay, Fennec, would you mind just introducing yourself one more time?
Yeah, no problem. Can you hear me okay?
Yes, you sound great.
Oh, okay, let's see. Can you hear me? Hi, I'm Fennec Oak. I use he, him pronouns. I'm a trans person in private practice. I have worked in crisis for many years and with LGBTQ organizations for many years. I'm in the LGBTQ spot. And pretty much I'm just here to try and make sure to support my community and this crisis work as much as possible. So thank you all for having me.
Welcome, Fennec. And Fennec just joined our CRIS committee to represent organization that serves LGBTQ community members. So thank you so much for being here, Fennec, and for jumping right into the deep end with us. So now I'd like to have folks start sharing out some of the criteria they come up with. And CRIS committee members on Zoom, I'll be checking in with you as well. So please feel free to either raise your hand to speak, or if you'd rather share your criteria by chat with Michael Anderson-Nathy, he will share it out on your behalf. Does anyone want to get us kicked off? Anyone have any initial thoughts on criteria that they'd like to share? And I should mention that Michael Anderson-Nathy is going to scribe on the screen, which will make it easier, I think, for folks on Zoom to track. Yeah, we're going to be multitasking. Okay, great. Okay, then I'm going to ask actually Puck, Dr. Snowden, Fennec, and Anna, and Robert, if you have something you'd like to add to the chat, please send it to Betsy Jones. She's going to actually track so that Michael can scribe. All right, who wants to get kicked out? Oh, I see Bipasha. Yes, thank you for doing the table tent.
Gotta honor all the work Betsy did with the tents. So this is not specific. I just want to make a statement that I've heard from lived experience is like picking priorities is like asking me to pick between my heart or my liver or my kidney. And it's really hard to do that because we need all the systems to be functional. But if I'm using that metaphorically, I also know as a human being, if I have to lose my arm to let the rest of my body live, then I would do that. So it's that I just wanted to acknowledge this is not easy to do, but I do understand just as a single human being, as groups of human beings in the systems, we do need to pick priorities. But I just wanted to acknowledge this is not going to be easy. That's all for now.
I so appreciate those words, Bipasha, and I agree with you that prioritization, it's actually much easier to put a whole bunch of things up and much harder to start to call out what you're going to prioritize. And actually that triggers a really important thought. And I'm looking to steering committee members to reflect back if I have this wrong, but all of the work that you did and anything you prioritized today does not mean those other recommendations drop off at all. In fact, the point of synthesizing everything among the points, one of the reasons, hi Claudia. Oh, I'm so amazed. It's great to see you in person. One of the reasons that we synthesized everything into these documents is so that we can continue to track, even if certain things don't make it into the report this year, they're still here and we can still work on them. So thank you for triggering that thought, Bipasha. That's really important. Anyone want to contribute some criteria? Darcy.
Oops. In addition to what's up there, I think that we look for recommendations or elements that build standards, sustainability, and infrastructure. Monica and I were talking earlier about actions that happen because of the force of certain, of the will of the group, but we want things that can live on beyond us.
So things that create that foundation or scaffolding that we can build onto. Am I hearing that right? Okay. Thanks, Darcy. And is there anything else you wanted to add to that?
Let's see. I think most of the other stuff's kind of in there, just in different words.
Okay, great. Michael.
I wrote down, is it pinpointing diversity in ethnic, and behavioral severity?
Can you say that one more time? Sorry.
Is it pinpointing diversity in ethnic, and behavioral severity?
Okay, so now I want to make sure I'm tracking. So is the recommendation actually tailored to the diversity of where people live, their ethnicity, or their behavioral condition?
Yeah, absolutely.
Okay, nice one. Great. Okay.
And then the other two, one is it a modification or is it an actual conception?
So modifying something that already exists or something entirely
It's
new.
a conception, which is more important. We'd have to really kind of look at, we're not double dipping.
So when you're thinking about, and this, I think the steering committee will appreciate hearing your insight on this. When you're thinking about this, would you say like you would prioritize things that are a modification of what already exists, or would you prioritize things that actually reconceive the system?
We have, I don't know, 80 or so people that can always modify. We really, as we said, we have to really be cognizant of being in conception of ideas and implementation, right? And then lastly, is the priority bringing a wraparound versus action serviceable response? What I mean by that, are we prioritizing ideas that are in the back end, and it's in the back end, is it going to bring about wraparound response? And right now, wraparound response is real chic, and it brings about the nonprofit industrial complex to tap dance around our end result and what we're trying to achieve. The actionable response would be that we have people in treatment systems that are not harmful, right? That are trauma informed, that they're being addressed on a regular basis, that they're being steered in toward services and toward people, and truly nonprofit organizations that are about the business of people getting better, as opposed to capitalization and monetization and tokenism of persons that are actually in need, so that they're not in a hamster wheel of services.
So am I hearing you right, Michael, that you would prioritize things that actually lead to the outcomes we're trying to achieve,
Absolutely.
as opposed to just more outputs?
Absolutely.
Okay.
Because we can only do so much faith-based nonprofit meddling.
You want to results.
We're exhausted.
Yeah.
I'm sure there's a few people that work with entities who are exhausted with the nonsense.
I appreciate that. And I see a lot of tags up, and also I see Anna's got her hand up there. Betsy, did you want to respond to what Michael just said?
Michael, I wonder a friendly amendment on the, is it a modification of something that already exists? I heard you say we want things that exist, but maybe the best practice things that already exist, and then we want to innovate.
Yes, we
So
do.
can I add that as a friendly amendment?
Sure,
here? Okay.
absolutely, Betsy. I
Um,
trust you.
Oh, you
Right.
do? That's
Yes, I do.
lovely.
Okay.
Okay, and then I have from Mark in the chat. Can I offer his criteria? Or do you want to?
Anna, and then I'll come to you.
Okay, I saw we had Dylan as well, so.
Yeah.
So I have some chat.
And I have Tim's hand up, so I will come to you.
Come back.
But I will get to everyone, I promise. Anna on Zoom.
Hi, so Michael got to the one that I was gonna initially recommend, which was the pinpointing diversity and geo-ethnic severity. So I was gonna recommend looking at everything through, a equitable lens, through a DEI lens. So but the other criteria that I also wanted to recommend is that are the recommendations, we want to prioritize recommendations that will mitigate the stigma against people with mental illness, because this is a conversation that we repeatedly had where, when people are calling because there is someone in behavioral health crisis, they'll tend to call 911 over 988, and they might want that person arrested. And then, and so I think, if we can prioritize mitigating the stigma with the general public and with all of the, with the crisis response team and law enforcement, I think that would help quite a bit. I think, that will help with response in general, whether it's, someone calling or someone having to be taken to a behavioral health facility. So so that is what I wanted to include.
Thank you so much for raising that. And that was definitely a theme that came up frequently in our conversations this year about addressing stigma. So I really appreciate that. I'm going to take Dr. Stone's chat, and then I'm going to start going through. I think I saw Jessica and then Dylan. Did I miss any others? Okay, so let's start with Betsy reading what Dr. Stone's in the chat.
So Mark has 4.
Can you?
The first is promoting equity.
Okay, promoting equity. So there's some common theme there.
Yes, we're having some crossover.
Yes.
You may just add promoting standards across regions.
Promoting standards across regions.
New and innovative.
New and innovative, also an echoing a theme we've heard.
And crisis centered rather than other parts of the system.
Okay. So which of these recommendations are crisis centered?
Focusing on our scope.
So rather than radiating out, as we have a little bit, because systems are large and affect a lot of things. Mark's saying for now, he sees focusing on crisis centric.
Yes, and I think for our report, the way we've been conceptualizing that is that we add things to the report to say, these are considerations. You can't forget about prevention.
Yes.
Right? You can't forget about the post-acute service needs, but this is really about our scope.
Okay.
Yeah.
Great. Thank you, Dr. Snowden. So Jessica, I think, and then Dylan. You can just pull that sucker out. Yeah.
Just yanking it. So mine, I think, are kind of related to ones that have already been said, but I had tied together existing resources, but in a productive and supportive way. So it's kind of related to, there's one up higher about, where is it? Oh, easy wins and feasible to implement, building on processes and providers that are already doing the work in the moment, because we're building this crisis system, but crisis is occurring right now and crisis services are being provided right now. So building off of that. And then the other one I had was addressing emergency conditions first. And I think that leads us down another path of then defining what the emergency conditions are, because it's all crisis and it's all an emergency. But thinking about that idea of what has the most direct effect and impact for the individuals we're trying to serve. So what gets us the closest and has the closest effect for people, individuals who are in crisis, who are in need.
So building on pieces that we already have, but I heard you say in a really intentional way.
Really intentional way. So we're not just layering a new program over other things, which may take away from those existing programs because staff has to come from somewhere and you have to have people doing the work, but rather supporting those existing programs and getting them to the place where we want them to be, building off of that.
Got it. And then I heard you say prioritizing the recommendations that will address the most emergent or acute.
The pieces that are the very closest to what individuals in crisis are experiencing.
Thank you, Jessica. Dylan and then Michelle.
Thank you. And to build on what Michael, Dr. Snowden, and Jessica were all saying is around the changes in best practices is that we're looking, I would want to prioritize looking at the willingness to change or willingness to adopt certain standards, because there are lots of best practices out there. But if the people that are actually implementing and doing it are not able to do that or willing to do that, that's not going to go very far. And that also brings me to the next thing around investing in the technical assistance to make these changes happen. We can make out the plan, but if we don't have the people, the technical know-how to support the ongoing implementation, it also won't go very far. Thank you.
Thanks, Dylan. So the first off, recommendations that are feasible, that there's a willingness to pursue them, that's not an additional hurdle that we have to tackle. And then I heard you say providing the support, the technical assistance to make these things happen. Michael, is there?
No, that I was asking.
Okay, great. Michelle.
CEO of Crisis Connections, one of the 98 providers. So I first want to pile on to the does it further equity and safety? Put another thumbs up on that. Does it address a root cause? And does it support prevention? I don't want to lose focus on the fact that at the end of the day, if the work we do actually keeps people out of crisis, I would like to be out of a job, not work for a place that has crisis in it. So
I've heard that prevention point a lot. That's been a common theme as well. But I heard you echo the criteria that others have raised about equity, and you added safety. Does it promote equity and safety? And Michael, sorry, can you scroll back up I apologize. And does it address a root cause? Great. Joan. Let's get you that mic.
Oh, absolutely. I don't do a good job over at this mic.
You've got a lot of responsibilities, so it's okay.
Thank you. I'm Joan Miller with the Washington Council for Behavioral Health, and I agree with what everyone has been saying. I do have kind of a practical, boring criteria to suggest, which is, I don't know if these recommendations are intended to help inform the short session next year, but we probably need to prioritize what can we do during a short session? What do we need to wait for a long session to do, whether that's the complexity of a policy bill or the amount of money it's going to cost. That's probably a consideration we should take. Thank you.
I don't know if you and Senator Dinger had this conversation, but that was something she mentioned as well. So I don't think it's boring at all. And I imagine Senator Dinger doesn't either. Thank you, Joan. So so as a reminder, this upcoming session is the theoretical short session. And so what we pursue is a little different than in the other half of the biennium, where we can maybe be more aggressive. Michael Robertson, is that a new one?
Correct. Really quick. This is for 1, 2, 3. Do you have telehealth partners inside of this platform? Video phones, do we have telehealth partners yet, or what does that look like at the moment? I know that's a long-term question, because we're only a year in. My bad, Levi. You put you and Jan on the spot. Telehealth, like just dial up. some people- Absolutely. What is the long term? We vaguely touched on that months and months and months ago, just on a. seat of the pants.
Let's answer that question if we have an answer, and if not, we can make a note of it and come back to it. But that feels like probably a deeper conversation we need to have too. Oh, yes, please, Senator Dingra.
I'll just be really quick. Washington was actually leading the nation in access to telehealth before COVID. And during COVID and after, we really have been doing a lot around telehealth. So there's a lot of work being done in behavioral health and telehealth. And there's a telehealth cooperative. Is that the official? Yeah, I think that's the work. So there's a lot on it. One of my concerns actually has been in making sure that we still ensure we have one-on-one meetings, because so much of it has moved remotely, but we are a leader in that.
Okay. Those of you, so Jessica, did you have anything to add, or is that your legacy one? Okay. No, that's no problem, Betsy, and that's a old, your table. Did you have anything else you wanted to say? Oh, okay. No worries. Did I miss anyone else? Betsy, anyone in the chat? Oh, Jane, sorry, Jane. Okay.
Oh. So, just real quick on telehealth, there's actually a report that's Washington, like Senator Dingra said, our legislature during COVID said that audio only telehealth should be covered, should be a required service as well for people who have private health insurance, because we were really concerned about not everybody has a tablet, not everybody has a computer, not everybody has internet access. And there's a report due to the legislature from my agency, the Office of the Insurance Commissioner, on November 1. And we had a whole bunch of research done, and the place where audio only telemedicine is being used the most is behavioral health services. So that information will be out there. And then from the bureaucrat in the room, I struggled because clearly the biggest priority is what people with lived experience are asking for, because this is the place where people with lived experience probably have the strongest voice as recommendations to the governor and the legislature are being put together. But I'm also a realist. And I'm speaking also as a former legislative staffer. Legislature makes really tough decisions about what they want to invest in. And so, Michael, you're right about thinking about reconceptualizing, but also in prioritizing, thinking about where are investments underway that we can build on to make them more sensitive to the LGBT community, to people of color, to make it work better and adapt them more to be sensitive to the needs of people with lived experience and the input of people with lived experience.
So I appreciate Jane, you raising that. And I just want to call it I wouldn't call it attention. I'd call it maybe two things, to use Michael Anderson Nathy's words, two things that can be true. I hear a lot of you talking about not wanting to just put Band-Aids on the existing system and wanting to reconceptualize. I heard Michael say reconceptualize. And I also hear many of the same people saying, and there are people in crisis now, and we need to build on what we have to help those people. So I appreciate Jane raising that. I know that's a challenge and a tension that we're all navigating and balancing. And I wanted to just call that to the surface to remind us that I believe many people around this table are wrestling with that. Certainly, I think our steering committee is going to be wrestling with that. Betsy, with any other chats from? Okay. Okay, I think we're okay. So we've sort of figured out how to manage. All right, well, we have caught up a little bit. So what we're going to do now is we're going to take a break until 2:30. And then we're going to come back and we're actually going to start applying the criteria that we think is most important to providing some insights to our steering committee on recommendations. So let's take it's about a 10-minute break now. So just 5 minutes less than I originally promised you. If you're hungry, there's still some leftover lunches at the back and some cookies. There's coffee and tea. Bathrooms are to the right and around the corner. And folks on Zoom, I apologize that you had to listen to the housekeeping. We'll come back online. Please come back with cameras on at 2:30.
So. Did you want me to repeat that?
And no, you can continue. Apologies for the interruption.
And so because there wasn't anything that was centralized, I picked up my first and only criminal case because there was a breakdown in that system. Had I had the opportunity to enter into a system where they could access some sort of database that showed that particular doctor's care, I think the outcome would have been different. And so the centralized database was something that I personally feel could be of benefit.
Thank you for raising that, Marie, and for sharing your personal experience. I think that actually really does help crystallize what kind of situations that particular recommendation for it could address. So thank you for that. Dylan.
Thank you, Marie. That also brings to mind our CMT or point click care system, which I don't believe like police or fire have access to. But the idea is to be able to do coordinated care. It just makes me think about what that involvement and coordination can look like, while maintaining the confidentiality and making sure that people who are accessing this information can do so in an empathetic and in meaningful way.
So Dylan, I'm hearing you say that there's some logistical challenges, or there's some additional steps we'll need to do to integrate that, and that there needs to be a mindset of accessing that information in a empathetic and trauma-informed way.
Yes, and even amongst healthcare who are accessing CMT, there isn't necessarily a shared process of how to do that effectively. And so I know that there's a lot of communication about how we can improve and using these tools.
Okay, so it's not just creating the database, but all the steps that take in standardizing how the best practices for using this information. I'm going to go to Anna, who has her hand up, and then I see, I'm not sure who put theirs up first, but I'll go with Michael and then Michelle, and then maybe we'll move on to the next one. Anna.
So I just wanted to bring up D3, the Create a Public Relations Campaign to address the stigma, but I think it's also kind of tied into D3 and D12 can kind of be tied in together because it's on a community outreach and education campaign. And so I've just noticed that those points of like a public relations community outreach campaign has kind of been mentioned multiple times in the different recommendations. So I just wanted to bring that up because I think it's really important that the public is more educated on people with mental illness. I think it's just going to help reduce a lot of the issues that we're running into, and also allow people to know that this resource exists, because a lot of people don't know about 988 right now.
Those are excellent points. And I think that aligns nicely with the criteria that you mentioned earlier about addressing stigma and that issue. So thank you for raising that. So a reminder, D3 is create a public relations campaign to address stigma against behavioral health conditions. And I remember the meeting, we talked about that. And I remember Representative Dent speaking passionately about that. I remember Anna speaking passionately about that. So this is something, oh, fabulous. We've got the images up. Well done. At least we're getting there. So thank you for raising that. And then Anna also mentioned the community outreach and education campaign on 988, which actually did get quite a lot of dots here as well. So thank you for that. All right, so let's go with Michael and then Michelle.
D3. I think as we compile statistics and information and data, being that it's a response and there's a coupled and a parallel area and geographical as it relates to law enforcement and first responders, so precincts and districts and that type of thing, that there should be a grading system for first responders and persons that go to address and how we do. So it would be, we know that we have a co-occurring epidemic right now, which is fentanyl. So we would have the data on what is, are people acting out under the influence? How many overdoses? How many What is the mortality of those overdoses? What does that look like? Are persons engaging the police? How often are the police showing up? How many times have they had incidences of in the past or present of police intervening inside of mental health crisis response and giving people a better idea if we're talking about transparency with the public, right? So those each of those places would have a degree and a grade so that crisis response teams and first responders, et cetera, even them, they would be able to be accountable to themselves, and they'd also understand the information. I think that that's important, that we're not just going in and out and just whatever.
Okay, so Michael, can you remind me which particular?
I think that would be more related to D3.
D3 is the public relations campaign on stigma.
So
Okay.
that would be public access, public information.
Oh, I see. Okay, so,
yeah,
so providing those data to the public.
Absolutely. I have a son, a daughter. What is the likelihood of they're going to get proper care, proper response, and how do I handle this situation? Do I dare use this system? Is 911 going to hijack my 988 call? What is the likelihood of that? Should I have more people around observing this incident or this encounter? What's going to be needed? And so they would have a grade. The central district is going to have a different grade than Madrona, would it not?
So I hope too, Michael, that if this recommendation gets carried forward and we work on it, that you also are involved in helping think about what that and advise on what that campaign should cover, because those are all really excellent points about what this particular campaign should address. So thank you for raising that. Michelle.
So just going back a couple of conversations ago, this is referring back to coordination with first responders. So one of the things that you had mentioned was around the click care. So we have to make sure that we're also doing a really good job of telling folks what is already out there, and particularly things that can be replicated. So at Crisis Connections, we have the One Call program, which is jointly funded by the City of Seattle and King County, where because of emergency circumstances, first responders can call us 24 hours a day and talk to a clinician. It's a live answer, it's prioritized, and be able to get access to care plans. Is a person tiered? So we have permission, because of the circumstances of crisis, to share all the information. And that has been just well received by first responders. We're diverting people from going to the ER or jail. So this is another one of those where we should really look at how can this be replicated, because in times of crisis, we're also providing clinical guidance to first responders to make sure, again, that as much as we can to help support that person that the first responders are engaging with, to make sure that it doesn't escalate the situation, that they're given options that are the right resource at that time. So just again, to think about making sure that we're not trying to create something new. There's a couple of areas that I was sharing as well on, there's something on one of the other boards around create a database. Well, we have a database. We have a statewide database, 211, that we could build out. Ideas of integrating to make sure that we have youth peer run, helpline. We have one of those. So again, making sure that we're always, this is how these things come out too sometimes, is we have no idea that the healthcare authority is funding my organization do a statewide youth line that's answered by youth. So this is why it's so important to get together, because we can uncover, like, we already have something, let's make it better.
That's exactly right. I think that's a huge advantage to coming together. And in fact, folks, if you've noticed things today, like Michelle did, things that people want that we may already have some breadcrumbs on, I use that word again, then please, when you go back into that synthesis document and make notes and share it with us, because that's going to be really important. I'm going to do a two-week time check here because I see Claudia has something. I think Michael's maybe got a chat or something. Oh, awesome. Okay, so I'm going to take Claudia, and then I really want to move us on because I think we're going to run out of time pretty soon, believe it or not, if we don't talk about the other boards. So Claudia.
Yeah, I just want to follow up in a couple of comments. One is, if all those services are available, then we really have an issue with marketing, because there's no people of color who knows about a youth line they can call. They call me. They call me when the child is in crisis and say, hey, Claudia, what do my blah, 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 especially for people who speak different languages. We really need to make an effort to disseminate marketing. And the other thing that Michael was mentioning in terms of the diagnosis of mental health and SUD is really how we create that open door where we have that access point where we're looking at both mental health and SUD. We have a lot of work to do in terms of CFR 42 on how we are going to be able to break all those barriers and all the stuff that can go into a short session, but we really need to look at the parity. Substance abuse have to come right up there. We're seeing a lot of issues now. The youth are coming to us, they come in substance abuse. We cannot release that information. There's a lot of issues related specifically to substance abuse and how we diagnosing and assessing those.
Thank you so much, Claudia. So I'm hearing a few things there, but one of them is really echoing a theme that we've heard a few times, which is, and I think it's on one of these recommendations too, that bringing attention to substance use disorder at the same level and supports for addressing substance use disorder at the same level where we address mental health. And I also heard you make an echo for public relations campaign or a community outreach campaign specifically targeted toward making sure that people of color and newcomer immigrant refugee communities have access to this information because, we may not be aware of it. All right, let's move on. I'm going to grab the next set of boards. Yes, please.
Just a few comments, at least that I got in the chat from Puck. One, I think, is a reaction to something Michael Robertson was saying around using statistics to allow people to make more informed choices and to help build trust in the system, I believe. And then in relation to the 211 comment, 211 is inaccessible and there's no way to search it. And so I think just some input or feedback about 211 as a database.
Okay. All right. I'm going to just maneuver some new boards up here. So now we're going to move on to someone to come. So Michael's going to put those images up. Fair enough. I'll tell you which ones I'm going to call out here. I am seeing a lot of green dots, so I really want to talk about those. So I-5 has a pretty substantial cluster of green dots. So now we're on the someone to come document. Yes, please. So that's the third page. All right. So what I'm saying here is advise on how to make it possible for vulnerable people, particularly people of color, people who identify as transgender and LGBTQ+, and youth to feel safe calling for help in crisis and build and sustain more trust in the crisis response system. So that got a lot of dots, green dots in particular. Looks like we have green dots also on advised state agencies on regional collab. This is I-6, advised states agencies on regional collaborations to address equity and systemic failures. So those are directly related. And then down here, I-9, also green dots, do a root cause analysis on the lack of trust between systems and proposed solutions. So those are some of the interesting ones that I saw here. There's also one with a lot of dots up here, one green dot and several yellows. Support. So this is actually echoing one that we had in the previous. This is I-1. Support development of crisis response workforce, including peer support that has shared language, cultural background, and other shared life experiences as populations served. All right, CRIS committee members, other things were there any observations here that you noticed or any recommendations you want to make sure we highlight that I didn't call out specifically on the someone to come set? Michael.
That page in particular, when it dealt with peer supports, and there was also another portion that dealt with certain types of trainings, awareness, and updates. It is important along the lines of what I said earlier today about the nonprofit industrial complex and how do we keep those out of the systems that we're trying to implement so that people aren't jockeying to get the big SB contract, you know what I mean? And that can happen where you lose the integrity of what peer support really is. And we have people just checking box, using vernacular that sounds great during the contract negotiations, et cetera, et cetera. That's all.
Okay, so you are particularly calling out the recommendations related to making greater access to peer supports and training, but doing it in a way that we don't create unintended consequences or incentivize the wrong things. Really appreciate that. Okay, I see Joan, and then I'm going to go to Puck. Oh, we got a few hands. So I'm going to go do Joan, and then I see Puck, Fennec, and Anna. So Joan.
Thank you. I put a dot on the recommendation related to a more granular analysis of distribution of mobile crisis teams. I think we need a lot more information about the need in communities for youth and for adults to determine how many teams need to go where. And with that information, we can help think more about how to equitably fund the system. Because if we want these teams to respond more and more quickly, I anticipate that we'll need to fund the system such that we have teams that are being paid to wait, similar to other emergency responses. And so I think we're still lacking some data there to make those decisions.
Thanks for raising that, Joan. All right, I'm going to go to the Zoom folks. So let's start with Puck.
Hello, can you hear me?
Yes, we can hear you perfectly.
Yeah, cool. So a thing I've been doing in my personal mental health practice around is recognizing that if I harm someone, even if I didn't mean to harm them, I still harmed them. And it doesn't help for me to explain what my intention was. Sometimes it does, very rarely it does. Mostly I just need to sit with the fact that they are harmed and that the approach I took didn't work. And this is why I didn't put any dots by any outreach campaigns about telling communities that they should feel safe calling the crisis lines. Because I put my dots next to the things that are like, let's look at the problem. Let's try to make things better, but we're not out of time yet to say, hey, we've made things better for these marginalized communities, because we haven't. So that's my thought on those stops.
Puck, thank you for that. So I'm hearing you say that your dots, what you prioritize, were things that are getting at making the system actually a safe place for people, particularly people who've experienced the system and been harmed by it, before we actually start promoting the system. Thank you for that. Yes, this one, I think in particular, Puck was talking about many of the recommendations under equity and safety, and referencing back to some of the recommendations we talked about previously about communications and public outreach. So there's probably a group of recommendations rather than an individual one. Okay, next up is Fennec.
First, I want to say I really appreciate what Puck said about telling communities what is and what isn't safe. The one I wanted to speak to is F6, which is having a centralized hub of data for individuals and family members. I think specifically for LGBTQ people, a lot of times, we're in crisis for many reasons, but one of the reasons can be that we do not have a family system or a community system that we come from that is supporting us. And being able to have people within our chosen family to be able to access the crisis documents that we put in place, besides only people who have legal connection to us, and how often that community of care cannot access these documents because it's hard to be able to create releases of information for people. And so it ends up being people who have the most knowledge about the system, who are those supports, rather than the people who are the chosen family of those who are in crisis. So just making sure that that information can really be continued on and helped by people in their communities.
So Fennec, thank you for raising that. That's actually something that's come up before from CRIS members. I know you're new to us, but I think you're calling out something that's been raised by other CRIS committee members particularly for some specific communities, the chosen family is really, really important. And I'm hearing you say that this information needs to be able to be accessed and people need to be able to state who they want to be able to access it, because it may not be the ones that just have legal access to it. So thank you for that. Anna, I'm going to call on you just a second. I'm doing a quick time check. Okay. Anna, and then let's talk about what we're going to cover in our last few minutes together. Anna.
So H1, pursue consistent funding for mobile crisis response rather than braided local funding. We are not going to have equity in our behavioral health crisis system if there's not consistent funding across the board. What will happen if we just rely on local regional funding is the affluent neighborhoods are going to have a better system of care than the poor neighborhoods. So I really want to emphasize the consistent funding for all regions. Also H1.
H1. Okay, so just everybody, this is, I'll just read it to you. Thank you, Anna. Pursue consistent funding for mobile crisis response rather than braided local funding to expand workforce and improve response times. Yes, I know that sounds like a pretty unsexy one because it is talking about funding, but it did get a lot of dots, and I've heard many of you raise this before. So, okay, we do have one. Brittany, correct me if we have one person sign up for public comment today. Oh, they pulled out. Okay, all right. So we have a little more time. That's all right. So we're going to just keep going until we run out of time. Anyone else? I'm going to put my mask back on. Anyone else want to speak to a recommendation on someone to come? Michael and Joan, those are old. Those are from your. Okay, just want to make sure I don't want to miss you. Yeah, no, it's all good. It's all good. I didn't want to ignore you. All right, let's move on then. I have really tangled myself up here. Let's move that. Okay. So I'll tell you what I see here. I'm looking at M2. I see 3 green dots here and several yellows. This is expand juvenile justice programs that provide wraparound services to youth with behavioral health diagnosis and other needs. So that's one that sounds like it's pretty important to our folks with lived experience and many, many other CRIS committee members. L16 has 2 green dots. Sorry, Michael. I hope I'm not making it's down there. Ooh, I'm gonna dodge over here now. Develop recommendations related to prevention services, including investments in basic and social services, and ensure equity in prevention services across the state. I think Michelle said it really well earlier. She'd like to work herself out of a job. So this particular recommendation has an added nuance. It's not just talking about prevention, it's talking about equity and prevention services across the state. So that I found really intriguing to mention. Michael, this one's for you. L3, expansion of peer respite and peer support services is key to providing access to crisis care to meet people where they are at. I see 3 green dots and a whole lot of yellows clustered around that one. That one's L3. Sorry, Michael. Okay. And another one here, same page, Michael, L10. Ensure training for organizations on how to use peer support. Again, this was something Michael raised, including how to access current HCA trainings on this topic. So other recommendations that folks want to call out that I didn't mention here. This is somewhere to go, a safe place to go. Anna.
I just noticed L1, there's only a couple of dots, one of them being mine. And as somebody that advocates for people with mental illness across the state, the consistent thing I keep hearing is that anytime there is a new behavioral health facility being proposed in an area, there is always community pushback. Maybe not as much in like King County and some of those areas, but everywhere else across the state have run into issues, and the NIMBYism is really bad, to the point where we're not going to be able to expand these services across the state for a very long time, because the communities keep finding any type of way to litigate or to push back against the facilities. And so I really wanted to kind of bring that up in L1, because there will be community pushback when facilities are proposed.
Thank you, Anna. So this is the one about, I know some of you can read it and some of you may have the same condition I do, where you really should get some glasses. Anticipate and prepare for response to local community concerns and potential delays due to litigation and building new crisis centers and facilities. So be prepared on legal challenges and create a public relations campaign to educate communities. Anna is calling this out as something really important to be proactive about now. Senator Dingra.
Oh, yes. So clearly, I was the second dot on that. I do think this is critical. We did investments in certain areas, and it took 2 years for them to even start building that facility. And if we have to really try to address this, because if dollars are there, the people are willing to do the work. If you're waiting for 2 years, they may no longer be interested in doing that work. And so you've wasted 2 years in going through this process, wasted money, really, because there is no end product, and you still get nothing. This is really critical in making sure when the dollars are available, when the people are ready to do the work, we're actually able to execute on that work.
Thank you. And I did want to just call out another one I noticed that has 2 green dots. L5, research in-home stabilization services as a promising model for adults as well. So this is referencing the model we were introduced to by Sherry Wiley with a mobile response and stabilization services for youth model. And this recommendation came out of that conversation. Can we look at that for adults as well? Michael.
Senator Dingra said, in King County, we're specifically investing local dollars in a safe place to go. What struck me was how much there was more input on other areas. And I guess I want to hope that we will really dig into the safe place to go and what that means, so that, because as in King County, very excited about what we're going to be doing, but want to make sure that we're like even keel with like state standards and vision. It's going to be years before we see buildings. There'll be funding coming, but I also feel like we're kind of moving towards that. So I just support the planning and the visioning. So maybe digging into this a little bit more could be helpful.
So as we're thinking about our 2024 work plan, Michael, that this is something that maybe we can dive into more at the same, and you're absolutely right. We did spend a lot more time on someone to call and someone to come. So there might be some opportunity to dive more into a place to go. Vipasha.
What you said about Sherry Wiley pointed out to me at the peer conference when I put up the 3 buckets of SAMHSA, the third being somewhere to go. And she said, you know, for youth, it's a safe place to be. But the more I thought about it, I thought, well, that should apply to all of us, a safe place to be. It's not age related. I want to be in a safe place to be. And sometimes, like for me, when I had my suicide attempt, a couple of times a safe place for me to be was in the ER. I needed that help. Sometimes the safe place to be can be within your home where you can contact someone in your extended family or friends who are family who can come be with you. And sometimes it is, you might need to go to the 23-hour center. You might need to go for longer term. So it's a low-hanging fruit to change Washington from not somewhere to go, but a safe place to be for everybody. So I just wanted to reiterate that. And I do want to say that, you know, I live in one of the wealthier East Side communities, and we've had to show up, my partner and me, for so many, and this is what I mean, we're talking here, but you have to show up for your city hall and tell them we're okay with these places in our communities. It doesn't change unless we, as people who live in those communities, especially if we have the privilege of, you know, wealth, to say we're okay living with those people, because those people are me and us. There is no those people. So it's easy to say, but I know this is on record. So I'm just putting out a call to anyone who's listening. Please go speak to your city council and say you're okay with that.
So I think 3 takeaways from there, Bipasha, please correct me if I missed something, but rather than calling it a place to go, a safe place to be is more inclusive and appropriate here. And second, like what Fenwick was saying earlier about having systems that are inclusive of the different ways that people experience family and want them involved. You're saying also a safe place to be may be different for each individual, and we need to acknowledge that. And then I hear your call to action to be an advocate.
Community, you know, I mean, the mainstream places immediately may not be. So, you know, while they transition from being an immigrant, feeling comfortable with the local culture, they might prefer to have someone from within their community be a point of safety for them. Obviously, the system has to figure out at that point what it is. So I think it sort of echoes what Claudia keeps saying over and over again, that we have to think about people who immigrate and necessarily don't speak English right away. You know, some of us do, some of us don't. So a safe place to be resonates more for me.
Yes, I appreciate that. Any other recommendations? Oh, yes, Jan.
8.
Dan, can you just talk right into the mic? I'm not sure it's picking you up there. Sorry.
I wanted to comment on L8. Having adequate services or resources within your community. I think being able to access like a rapid response team or some type of intervention response, you need resources that you can divert and stabilize people with. And it's not sometimes creating a facility, but maybe looking at what you have in your community, but having the ability to access or purchase those resources in your community, having a shelter bed that you can have 24/7 access to, having a residence where there's in-home assistance that you can place someone at, having a hotel or motel where you can place someone for stabilization purposes. I think if we could balance that, not just build something new, but also look at what you have and how can you use it differently as part of your response system.
So a couple of things that I'm taking from that, Jen. One is that maybe building a facility is appropriate in one place, and in another place there are some other strategies that we can and should use, and you need the flexibility to be able to do that. And I also hear you and I also hear you echoing what has been said earlier about finding creative ways to use what we already have to meet these needs and achieve the objective articulated here about ensuring that there's adequate services available in all regions.
Low-hanging fruit what is readily available to us. Let's look at what we have and how can we expand that? How can we enhance it? Because we can probably get there quicker, use that sooner than if we would have to build a new facility or something of that magnitude.
I appreciate that. I do want to balance that again, and I'm just reiterating something we've all been saying all day, which is build on what we have, but don't miss opportunities. I think Michael said it really well earlier, to reconceptualize the system. And then I really want to call out what Puck has said to us many, many times, which is we can't keep repeating things that are causing harms. We've got to figure out what's causing those harms and address those. And I know, Jan, that's not what you were proposing, but I think when we talk about building on what we already have, I also want to kind of remind us of what we've said about that as well, and with respect to some of the other feedback that people have raised. Michelle.
So I just want to spotlight something a little more that I feel like we haven't talked enough about. And that is about the fact that for many organizations, we're reaching a point where we are at 50% capacity for filled positions. The workforce is leaving this field and it's not being replaced. So when we talk about all these really exciting, important ideas, it's only done by humans, and humans that are trained, ideally humans that are coming with lived experience. And, you know, we're already struggling right now to fill the roles we have. We're trying to, as well as Frontier and VOA, to expand the 98 program, because we're in year 2. I've had 2 program manager positions opened, and we are able to hire people from across the country because it's remote roles. We're not getting any qualified applicants. So we've, thanks to the legislation, the 98 fee, we are able to pay much closer to living wage. That's the bare minimum. So we are competing with, larger healthcare facilities. We probably end up competing with each other. None of this is going to happen, all this growth and energy and work, if it's just us around the table who are doing this at tables. We have to continue to focus on building that pipeline, reducing barriers for people to get into this field, and be able to even fill what we have right now. Our calls to the regional crisis line are not going down since 988 launched. Everything is still going in the direction of more people needing the support. So if everything that has been said is absolutely, I think we all agree, spot on, we're talking about the right things, but I'm very, very concerned that all of this is going to come to a complete stop if we're not able to fill these positions. I know that, I talk regularly with our BHASO partners. They're trying to fill existing roles for outreach, for mobile crisis teams, for DCR, so forth. If we don't start working on developing a pipeline and incentivizing and retaining the staff we have, all of this, we talked about NIMBYism, and that's preventing and getting in the way. We build these facilities, I don't know who's going to run them. Who's going to run them? So again, even if people are frustrated by the timelines, if we don't have the workforce, trained, supported workforce, we're talking about another 10 or 15 years because we're already behind. So I really just wanted to pause this and put a light on that, because that is my number one concern with all of this.
Thank you so much, Michelle. And I'm reflecting on the criteria we talked about earlier about addressing the most urgent issues and the things that are that would be roadblocks to any additional advancement. So I appreciate you raising workforce. We have about 3 minutes, and I do want to take a minute just to remind everybody of next steps. And Senator Dhingra is also going to say something. Michael, I saw your tag up. Did you have? Can you do a quick one, and then I want to grab Puck, and then we'll wrap up.
And touching on exactly what she said, and I had a conversation with Rep. Orwell and with Lauren, that as a peer and person who's face front in this service, if we don't begin to reestablish the language and how we describe front-facing services and the people that perform them, the language and how it's described, and even though the function is right, the language as it's described at present is really stale, and it sounds hokey for people that have never actually used the service, and therefore people are kind of reticent to really engage. And also along the lines of the nonprofit industrial complex, they're also gumming up the works. They're just not paying because they understand the persons that are most likely to be face fronting for them, and they can kind of push around. And so that's a whole conversation for another Oprah, but it lies along those lines. So we really
I hear you highlighting some of the potential barriers to what Michelle was talking about, getting the workforce. Yeah.
We really have to redefine exactly what it is that is for persons that are really for persons that are really upfront. We really need to redefine, because it sounds really not in a bad, and it's no fault of it. It's just, it's 2023. We really got to reset the tone, reset the language.
Understood.
Have it trauma informed isn't going to get it anymore.
Thank you, Michael.
Got to be industry informed.
Agreed. And it sounds like something, again, where we'd want your advice on that when we get to that piece. Puck, did you want to say anything?
Yeah, I was just wanting to echo what Michael's saying. We should convene a group to talk about workforce.
Oh, Puck, I'm so sorry. I'm having a really hard time hearing you. I apologize.
Sorry. Echoing Michael, we really need to convene a group to talk about workforce issues, because there are a lot of issues right now with peer stuff that I think the lived experience community keeps trying to talk about, and we're not being heard. And on top of that, like the amount of support that marginalized communities are doing for each other, like I would be working as a peer if I wasn't working full time as a peer in my regular life, but I am. And so I don't have the energy to do it for a job. And so it's this kind of vicious circle, vicious whatever spiral, where we don't have the capacity to skill up or to get into these peer positions because this system is broken and isn't holding us up enough to be ready to get there.
Thank you, Puck. So I just want to acknowledge we heard voices from 3 people here about the importance of the workforce piece of this. And when we talk next week with the steering committee, that will definitely raise that up. I think we've done that, and we are pretty much almost out of time. So I'm going to ask what? Yes, please, Claudia.
Ken, we all talk about workforce, and also when you have so many representatives from all over. Sorry, I get excited. I forget about everything.
Me too.
Listen to me. When we have representatives here from all different disciplines, and in so many committees, and every committee that I am, somebody has a new project or a new pathway with new type of employees, behavioral health technicians from it. I mean, name it. It's coming away from the feds to new monies into behavioral health. I don't know where we're getting the staff. I have facilities right now who are open and ready to run too, because I don't have anybody. I mean, I'm here. So really, honestly, is how we synchronize the efforts that are coming from here with all the funding that coming down, because we are going to overwhelm tax the system that we already have that is broken. It's going to be very difficult to develop all the initiatives that we're trying to with no staff.
So workforce development and alignment with all the pieces. Okay. Thank you, Claudia. That was a good way to wrap that up. Senator Dingler, do you want to quickly just, here, I can give this.
I just want to close us out by, first of all, thanking everyone who was here in person and remotely. I think it was such a great experience seeing everyone in person. So thank you for making the effort to be here. I do want to thank Marcus for handling our technical difficulties, and Michael for running logistics, and then Jamie, just, I know is so hard to see you running around handling us on screen and in person. So thank you for doing that. I just wanted to go over just the structure of these committees and what the next steps are, and to take you back to when the original bill was drafted. The purpose really was to make sure we're hearing from everyone before the recommendations are voted on. So it really was the subcommittees that are doing the work, sending all that information to us at CRIS,
us doing the work, having these conversations, and then making sure that the steering committee gets these so that they then can vote on it, and then make sure we have these recommendations and the great work that goes behind them. And I hear you, Bipasha, that the arm is important, like the heart and the brain. Unfortunately, we're going to have to choose. And this conversation, the prioritization, all of this is really, really helpful in really ascertaining what is the brain, what is the heart, and then moving to the other body parts. And I'm stuck with that analogy. So the next step is for HMA and Jamie to synthesize and summarize the themes, the discussion. The steering committee will meet next week, and they will deliberate on what they've heard today. They will then determine which recommendations should be included in the 2024 progress report based on all of this feedback. And I think this has just been so important and so critical. And, we've talked a lot about being practical and, low-hanging fruit versus longer goals, and talking about a shorter session. I just want to say this work has always been about having a bold vision and about making changes that we know the system needs. So let's make sure we don't negotiate against each other. Okay. So I still think we need to be bold and take into account what we're hearing from the lived experience work groups on using this opportunity to do what we need to do. So thank you all so very much.
And I'll just say a quick thank you to everyone for your grace and kindness today with our technical challenges. We hope to do another in-person one. We'll iron out more of the bumps before we do it again. But and also a big shout out, Jan, thank you for traveling, and anyone else who traveled to be here. And thank you everyone on Zoom, our CRIS committee members and our people with lived experience and our ASL interpreters and our community who support us and participate and engage. And I hope everyone has a safe travel home. Simon. If you really want to keep your postcard, I will gift it to you, but otherwise I will use them again if you want to return them to me. I know, I have it on doing that. Those are great stories. Oh, thanks, Michael. Oh, yeah. Don't forget to get your parking discount if you need it. Michael's got them.